Hey, good morning. Back to the PCT review. The usual look in the backyard. My bunnies are out. Not my bunnies, but the field bunnies are out, so maybe they will come into picture while we're talking. Anyway, I hope to finish up this part of the PCT review today. We don't like much. We're starting here where it says low lateral dermal supplies. So, with the low lateral, high lateral, these are just positions like the semi-Fowler position. So you can look through there and see these. Most of the time, they're talking about putting the patient in the semi-Fowler position. Okay, 45-degree angle. When you go to do any procedure, you want to make sure that you have all your supplies gathered up. That's part of a couple questions in there. It's like, like bathing, your phlebotomy. Make sure that you have all your supplies when you're there. That way you don't have to leave the room or go get other supplies. Green top. Remember the vacutainers tops. Green top is affected by clotting. Red top last because it's supposed to clot. In the light blue, not recommended for dermal punch. Lavender top is first on dermal samples. Minimum clot formation in the lavender top. When we talk about heart attacks, ST elevation, ST depression, remember ST depression would equate to ischemia, elevation, infarct, or injury. The stoma, usually the stoma when it leaks, remember we talked about the colostomy bag, the stoma is going to leak around the wafer. Remember the wafer in the colostomy bag helps form the seal. CHF, congestive heart failure patient, edema, report the edema to the nurse or swelling. This is the list of questions where you find that what would you report to the nurse, and you would report edema or swelling to the nurse. CVA patient, cerebral vascular accident or stroke patient, change in the pressure sore, the ulcer, because they're non-ambulatory. So this stroke patient, you would look for pressure sores because they're not able to walk. When you do venipuncture, you gather your supplies, what we talked about. Always check the seals. Make sure the seals are intact. If the seals are not intact, then you would discard that needle in the sharps container. There's some questions on able to lift. When lifting the patient, one of the first things that you would do is your ability to assist. When we lift the patients and we move patients, we want to make sure that the patients are doing as much as they possibly can. So you would determine, when you go to lift the patient, you would determine your ability to assist. What is your ability? Are you capable of doing the lift or the move without assistance? U waves on the EKG, look that up. There's a little bit of work to do with that, understanding U waves, but as far as question is concerned, it's a decrease in potassium, and you would tell the doctor that would be your the answer to that question. When you draw blood, we talked about this in part 2. Always look for the AC, the antecubital space, multiple draws, then the median cubital. This would be in the antecubital space, this would be the vein in the middle. Vocabulary, polyuria would be a sign of hyperglycemia. So there was a question on the order of draw in an infant. So if because the child is crying, you would draw the O2 level because of the crying. I know that these are really random, but like I said, if you've done the PCT review online, then some of this will make sense. Again, it's going to say, you go into the room, you're doing blood pressures, you get this blood pressure, what do you report? This one got me as well, but the answer was you report the 131 over 81, not the 98 over 60. Remember, that's sort of the 131, 30 to 80 diastolic, 90 diastolic is approaching that hypertension. In the EKG, you need to know the difference between lead 1 and lead 2. Remember that triangle, how lead 1 goes from the right across the top, from the right to left, and then lead 2 goes from the left down to the right, down to the side. You would do inputs and outputs per shift. Okay, it's going to say, hey, when would you record your inputs and outputs, and it was per shift. Things with SpO2, where you were unable to obtain an SpO2 is the blood pressure would be low, or the patient would be cold, might have a fingernail polish there. Remember, hepatitis B is a blood-borne pathogen. Standard precautions and gloves. In TB, tuberculosis is respiratory, so you would require an N95 HEPA mask. When we look at these questions, okay, look for parts of the answers that are incorrect. Remember that if any part of the answer is incorrect, the whole part of that answer choice is incorrect. And then signs and symptoms, when it's asking you to discern between signs and symptoms, pick the worst sign and symptom there. On a pacemaker, remember you have this pacemaker spike. See if I can get the picture in front of the camera. Right there, that little spike before the P wave. You have a pacemaker spike there on the EKG. That tells you that they have an atrial pacemaker, and also that with the pacemaker spike, the QRS is going to be wide. That's normal for a patient with a pacemaker. GTT is a abbreviation for glucose tolerance test, and it's a test to see how well the cell is absorbing the glucose. Granulation, if you clean the wound by granulation, it's a 24 hours. I think we went over this in part 1. New connective tissue on the surface of the wound. So you would change that. Oh, the sun's come out. That's a distraction. Okay, so the change that every 24 hours. EKG, this is going to be the most, because of our circumstances apart, this is going to be probably the hardest part of the PCT exam for you, because in that phlebotomy, because we didn't get to really finish. But make sure that you understand PACs and PVCs, junctional rhythms, where there would be no P wave, AFib, where it's irregular and there's no P wave, no discernible P waves. I would spend extra time on the EKG. A glucose test, we're back to phlebotomy, should be done before eating, and that is 2 hours. A PP glucose test pre-prandial or fasting before they eat. So you get a fasting glucose, 2 hours. Always lift with your legs, keep your back straight. Okay. If we were treating a disoriented patient, any altered mental status requires treatment first. So you get a scenario where you're which patient would you treat first? And you would always treat the one with the altered mental status first. We're most concerned with ST elevation on the EKG, leads to the MI. In your chart, you will need to know the different areas on your 12-lead chart, the different leads, like what is lead 2. Like lead 2 is inferior, and so you need to know inferior, anterior, lateral. They'll be asking you, the question would go, this patient has ST elevation in these leads. What section of the heart is that? When the patient's having a breathing treatment, albuterol, with the peace pop, not the mask, but the peace pop, the spacer is recommended for all ages. There's a little spacer in between the little bucket of medicine and the actual bite piece. We've already talked about OSHA guidelines, dispose of sharps in the sharps container. When we're doing blood draws or any specimen, you would label the specimen in front of the patient. You would put your initials on the label along with the time. Most labs will not accept it without your initials and time and then date, really. Apical pulse is felt at the 5th intercostal space. Well, again, I think this is repeating a little bit, but the implied consent, extending the arm out, or an unconscious patient. We've already talked about the wheelchair and the beds. Make sure that you lock the wheels before you move the patient. Express consent is verbal or written. Informed consent is intent and risk of the procedure. So an informed consent is you're informing like if the patient's going to have surgery, you're informing them of the risk of those that procedure. Got this patient with a hacking cough, red spit in the trash can. So you go in the room and you look down and there's this red stuff in the trash can. You would ask the patient, did they eat something red, before you would jump to the conclusion that it was blood. Make sure all your tests are ordered first. Okay? So if you have a vena or capillary puncture, make sure that the test is ordered by the doctor. The needle insertion is 15 to 30 degrees. That's an industrial standard. It's 15 to 30 degrees. Uh-oh. We're back to poo. Stool color. It's Friday. Stool color. Green is a sign of a liver. Red, lower GI. Black, tarry, upper GI. Yellow, dehydration or diarrhea. So do you know the difference in the stool? There's some questions pertaining to that. Some breathing exercises. Avoid deep breathing or coughing after eye surgery. The cough or the deep breathing increases intraocular pressure, so we want to make sure that we're avoiding that. Draw blood. Older people with butterfly or the syringe, we talked about that. They have more fragile veins. If you forget to draw a lab, keep what you have and redraw. Don't redraw everything. So if you forget one of the tubes, those other tubes are good. You can just redraw what you need. Listen to the family when they're ready to talk. Like if you have a dying patient, This is considered palliative care, and that you would just keep them comfortable. So listen is the key word when they're ready to talk. Tongue, swollen tongue or lips would be allergic reaction or allergies. You would, if you would see that, you would inform the nurse that they're possibly having an allergic reaction. On your samples, you have a chain of custody. So especially like alcohol draws and stuff. So this guarantees identification and the integrity of the sample. So there is a chain of custody. That's why we would put our initials and dates on the samples. Sputum or spit samples, coughed up. You're having a patient maybe with a little pneumonia. You just want to make sure that they haven't taken any alcohol mouthwash like a Listerine before the sample. It would degrade the sample. If there's when you're doing your blood draws, if there's no AC, then you would do the dorsal veins, which are the veins on the back of the hand. Usually when you do a dorsal vein, you're going to need to do a butterfly. There's smaller veins, so the butterfly would be the appropriate instrument to use. And we know direct pressure for bleeding. There's a type of tablets, enteric-coated tablets that make aspirin like this now, that they digest in the small intestines instead of the stomach. Aspirin's real harsh on the stomach, so most people who take aspirin take enteric-coated aspirin. And if there's a line down the center of that, it's called a score. This is usually due to in case you want to split that tablet up. Pale, diaphoretic. During a venipuncture, they may be having a syncope. Syncope, remember, is fainting or passing out. Nausea, lightheaded, queasy. For nausea, they'd be lightheaded and queasy, shock, cold, and clammy. So do review the signs and symptoms of the different medical emergencies. If you come across and you're doing a manual blood pressure and you make a mistake, just release the cuff, all the air in the cuff, and then redo the test, redo the blood pressure. If you're having a patient with a Hoyer lift, you put them in a semi-Fowler's position. A Sims position lies on the patient lie on their left side, and the right knee bent up, left legged straight. In a lymph, Lithotomy, supine, legs flexed. This is a surgical position or a childbirthing position. Let me show you that word. Too much for Friday. Almost done. Hey, so invert the anticoagulant tubes to prevent clotting. Remember, as you've read your phlebotomy sections, most of the tubes we would invert several times to prevent clotting. When we transfer a patient, make sure that the bed, like we're transferring from one bed to the other, that those beds are at equal heights. There's a question when the patient was afraid to go home. You would want to ask why, and talk to the patient about it, and then inform the nurse. If you have a patient that has severe hypertension, edema is critical, so you would inform the nurse There's this type of question is going to give you a patient with a high blood pressure, and then which one of these signs or symptoms are the most critical to the edema. Before you lift a patient, first check the ability to assist, and then second, the height and weight of the patient. We want to make sure that we're able to move the patient safely. Remember, a hematoma is swelling under the skin. It'd be blood that has pulled under the skin. Once you see the hematoma, you would stop the draw and release the tourniquet during phlebotomy. Contact precautions, we would have a gown and surgical mask. Well, a gown, let me back up. Contact precautions, we use a gown. Droplet precautions, we would use a surgical mask. And then airborne precautions, we would use an N95. Shoe covering for surgical procedures. So I know this has been like super random, and but like I said, if you're studying and you've done the review, the online reviews, the practice reviews, and the practice final, then these are going to make sense to you. There's another page that I won't go over here because it's topped out nice and neat, and it's just a matter of the same thing where we start looking at there. It's all nice and neat, and then there's no problem with interpreting my handwritten notes with that. And these are set up the same way. So scope of practice, vitals, blood glucose test, greet, instruct the patients. Very important, remove the restraints every 15 minutes, or check every 15 minutes and release the restraints every 2 hours. And then you can sort of go down through there. It's down in sort of the middle, gives you the like the different color tubes. So that's very useful information. Okay, so that ends this review, and we'll end it with part 3. The next thing that's coming out is I have another review that's based on the test, and in your yellow book I've given you, there's page numbers for you to look up some of the answers and questions on that review, and I'll be posting that next week. Okay guys, hang in there, keep on studying, review the information. We're not very far off from doing our test. Have a great day.